Hello and welcome to Natural Health Network. Natural Health Network is a nationwide directory of holistic healthcare providers, products, and services. And today we are meeting with pediatric dentist Dr. A of Happy Chompers in Katy, Texas. Thank you for joining me.
Thank you for having me.
I was really impressed when I met with him, so impressed that actually I moved my kiddos from their current dentist over to here. And so because he had so much insight and respect for just a more holistic lifestyle. And so tell us a little bit about yourself, your education background, why you got into this.
Yeah, for sure. So I'm originally from Long Island, New York. I grew up in New York, and as I was exploring career paths in high school and college, I was gonna actually be an engineer for the first 3 years of college, and then I knew something just was not right inside me. And then I had a family friend who had just graduated dental school, and I spent the summer with them working in their office, and I realized this was, I know it sounds cliche, but kind of like my calling, in the sense that I liked working with my hands and I liked serving people. So that kind of got my gears churning and looking at dentistry as an option. So then I went to dental school. That was the start of the journey. Went to dental school in Boston at Boston University, graduated in 4 years from dental school, and then realized towards the end, again, everything happens late in my life. Towards the end of dental school, I realized that pediatrics was something that I was really interested in, working with children. And then I did my residency in pediatrics at Albert Einstein Montefiore Medical Center back in New York. Did that for 2 or 3 years, graduated from residency, and then ended up needing a change of scenery and moved to Texas and moved to Katy in 2016 and opened up Happy Chompers, and here we are today.
Wow, and it's quite the practice now.
Yeah.
And so you have a couple of other dentists that work with you as well, correct?
We do, yeah. And really just going back to, I guess, why we feel like pediatrics is our calling is we find, or personally I found, that children are such a unique opportunity. They're a challenge, but a huge opportunity to partner up with them, with their families and parents, to educate them and empower them so they can instill good oral dental habits from infancy onwards and really grow and develop into a very healthy individual from not only a dental perspective but a holistic whole body perspective as well. So I think that's why this fits us so much. And we have another doctor here that kind of buys into the same philosophy and is a good fit, and we're blessed to have some help in the office to serve our family and their needs.
If they're working with a lactation consultant, that you allow them to come in with their consultant,
Right.
and be a part of the visit.
Yeah.
And that really intrigued me. And then also you have different laser services,
Right.
and things like that can address cavities. Yes. So
Yes.
tell us about what services you offer.
Yeah, for sure. So we are a comprehensive office. Our focus is not only providing comprehensive dentistry or dental needs, meeting our needs for patients, but also providing alternatives and holistic alternatives to our patients, right? So we want to be kind of like a one-stop shop for your children's dental needs, right? And that goes back to like why we do what we do and what started this journey professionally for me, from being a traditional dentist to a non-traditional holistic dentist, right? Was the story with our son, right? And I think everybody in this profession can always has that something that they can relate to or look to really start this journey, because not every dentist is able to provide services or even has the motivation to do so, right? So our newborn, he's 10, can't believe he's 10 now. When he was an infant, had struggles with breastfeeding, had struggles with speech growing up, and proper breathing and airway and snoring. And I wish I knew what I know now back 10 years ago, because his quality of life and our quality of life suffered and struggled so much. So that really helps us understand and provide that with that perspective in terms of guiding our parents and families and making sure that we are identifying these root causes and recommending treatment or interventions at the right time, so it's not too late and they don't decompensate or compensate in a negative way. So just using that personal experience as a tool. So that's why we are definitely open to having providers such as speech therapists, occupational therapists, physical therapists, lactation really being one of them, joining us in providing that care for our infants, right, especially, and being there for support and care while if they are ending up needing a tongue tie release or a lip tie release with a laser. So we're very welcoming of that cohesive and collaborative care. Some services that we provide in addition to that is we provide laser treatment for soft tissues. We provide laser treatments for laser therapy, which is called baby laser and laughter, which is another alternative to loosen up the fascia and the system to treat milder presentations of lip or tongue ties, right? We also are more conscious about providing alternatives. So it's not the cookie cutter approach of like you see a cavity, you fix a cavity, right? We want to help understand why the cavity happened in the first place. What lifestyle changes can be made? Is there any dry mouth issues? Are there any mouth breathing issues? Are there any airway issues? Any medical conditions that's contributing to that cavity? Is nutrition being addressed? Do we need probiotics, oral probiotics to help have good oral microbiome to make sure that they don't get a future cavity? And we really our goal is to partner up with the parents and provide them alternatives and options. If they want to do the traditional way, we're all for it. But if they are looking for alternatives and want to treat the caries or the disease in an alternative holistic way, we have options such as non-sedation treatments, SDF alternatives, right? So those are some alternative treatments that we offer. Very big on in screening for airway issues and breathing issues and snoring issues, right? Other than lip or tongue ties, because we find that that can have a long-term effect on the growth and development of a developing child. And just same thing going back to my son's story, and so we are very conscious of screening for that, and in that regard we are very cognizant about providing early intervention, right? So if the child has a narrow maxillary jaw or narrow jaw or any oral facial malocclusion that needs addressing, we are providing the option of functional orthodontics or early expansion to start as early as age 4 versus traditional orthodontics won't happen till 8 to 9, right? Mm-hmm. So early intervention, timely intervention is our focus for sure.
And then I think I saw something about that you specialize also in special needs children, and obviously the office is very friendly to that. So I've recommended you already to a few friends.
Thank you. Yeah, and we feel privileged and honored to be able to take care of those clients because it does require a certain set of expertise, not only with the provider but with the support team that we have. And I feel we are really blessed in the team members that we have that are able to treat patients who have sensory issues or are on the spectrum or have special needs. But yeah, we're very privileged and honored to provide those services for those kind of clients.
And then even your intake form asks if they even have anxiety, because I have kids that I took them to a dentist that unfortunately gave them anxiety around the dentist, and I loved that even your intake form considers that, and obviously you're paying attention to that.
For sure.
So I know you're a pediatric dentist, but I always like to ask, who is your ideal client?
Yeah, our ideal client or family would be somebody who is interested in partnering up with us in taking in the journey of oral health for their children, right? So we're looking for people who are looking for options or alternatives to just bread and butter cookie cutter dentistry. We are focused on working with families who want to get to the root cause of the problem and just not treat the overlying symptoms. Obviously that's important, but really getting to the root cause and educating themselves and their children with our guidance in making sure that we make those lifestyle changes and really be on the preventative side of things, because just treating the symptoms and not addressing the root cause, that problem is going to continue to reoccur or compound over time. So we're looking for people who are of that mindset.
Then we're in the right place, because anyone that comes to Natural Health Network is probably going to want that root cause. That's why we're here. So, do you have a favorite success story from a patient of yours?
Yes, I do actually. Most recently, I may have mentioned it earlier, but we started using this laser therapy a year ago. It's called baby laser photobiomodulation or laughter therapy, as an alternative to just a release with a laser of a tongue or lip tie, right? So we had this 1-month-old baby present to the office with mom who was having issues with breastfeeding, latching, and feeding. And during their consultation, after examining everything, we realized that they did have a very mild presentation of the lip and tongue tie, but we talked about either doing a procedure or release with the laser, or doing this alternative treatment with baby laser, which basically penetrates the tissue and it increases circulation and healing and stretches out or loosens up the fascia around the muscle or the tissue. So again, same thing, right? We partnered up with that mom, and she was all for trying this alternative, and we had 3 sessions to 4 sessions of that therapy on a weekly basis, and we saw tremendous and significant improvement in their latch, breastfeeding, and feeding overall, that we didn't have to do anything else. That, along with pediatric chiropractic work, made tremendous strides in their symptoms. So really, I was very happy with that outcome and proud of the fact that we were able to provide an alternative and not have to do an actual procedure, but get the same optimal outcome that we were looking for from the get-go.
I know from personal experience with my own son that the recovery from the just revision is a rough one, both for family and baby. So that's incredible.
Yeah, and as long as the mom and baby are happy, we got that outcome, and yes, we're able to avoid some post-op discomfort. It's always a win-win.
That's great.
Yes.
Thank you so much for joining me today and for sharing all about your practice and your background and history. And so all of Happy Chompers info can be found on naturalhealthnetwork.org. Go to the directory and look for their logo, and all of their links and social and everything is there. There's so much fun over on Instagram and social media to watch and to learn from. They post so much educational things that we also share on our social media. So if you're finding us on YouTube, there will be a link in the description to the Happy Chompers directory link, so it makes it easy for you. And this video will also live on your directory listing. So thank you again for joining us. And if you are looking for holistic providers, products, and services, head over to naturalhealthnetwork.org to find all of your needs nationwide.